are a medical doctor,
Yes.
50 years experience, clinician, policymaker and historian. Tell me a bit about the time that you were a clinician, and particularly tell me a bit about what you really valued working with nurses.
What I valued most of all was trustworthiness, person's ability to assess when a patient is sick, punctuality.
And patience, I think that was one of the things that
Patience,
you
yes.
were talking about
Yes.
as well. So tell me how you felt whenever you were working with someone who you trusted, who had that capability, versus someone that you were a bit wary of.
Well, I can remember one dragon that I...
Who was an angel in disguise, of course.
I was just about to say, who loved flowers, and I quite unwittingly found my way into her heart by admiring her flowers.
Oh, wow.
Who wouldn't tolerate being pushed around, and if you wanted to do a procedure, say a lumbar puncture, instead of saying I want to do a lumbar puncture now, what she expected you to do was to say, I need to do a lumbar puncture on that patient, when will it be convenient?
Yeah.
And she would give a time and say, everything will be ready at that time.
Yeah. So that was the negotiation, the respect, the trust, the competence. These were all the sorts of skills that you observed and were really, really useful and beneficial.
If it was somebody that I trusted, I would be guided by their assessment. If it was somebody that I was a little doubtful of, I would assess it for myself.
Right. As you know, I'm very interested in the fundamentals of care, or the basic things that we as nurses need to make sure we get right. But it isn't just nurses who have to do it, it's a whole team effort. And so for fundamentals like privacy, dignity, personal, helping people feel like themselves. So I know that you've done a lot of work in the past in obstetrics and gynecology, and again, very, very sensitive areas for patient care. Tell me some of the things that you observed that nurses did to sort of make the women feel better about themselves.
Well, the nurses who took the trouble to encourage the women to wear lipstick, put their makeup on, sit up in bed and look their best, were the ones who endeared themselves to the patients. And you only had to do it a few times, and then everybody followed the lead. And all the patients would sit up in bed with their lipstick on.
And everybody looked gorgeous.
And everybody looked gorgeous.
So we've been talking about the importance of sensitivity, respect, being able to understand patients' personal needs, their psychosocial needs, as well as their clinical needs. Have you any stories that maybe illustrate how we should be improving that area of our work?
I think that Kim's game, I've just remembered the name of it, Kim's game that the Boy Scouts used to play.
Very good.
Where a number of articles were put on a board and you were given a set time to look at them and memorise them. And then it was covered and you had to list what you'd seen. But from my own personal experience, which was not in hospital, I worked for a while as a voluntary guide at the War Memorial in Canberra. And there is a uniform in a case, in a glass case, that I used to stop in front of and say to my group, what do you notice about this uniform? And they'd notice the mud on the boots, and they'd notice the boots. And over a period of more than 10 years, only one person noticed that it was a very small uniform. Because most people regard Australians as big bronze Dantakes. This fellow was barely 5'3", I would think. And the man in the audience who recognised that it was a small uniform was a tailor. And so I used to say then, yes, it was a small man, and then talk in terms of how Australian physique has increased since the turn of the 19th century.
It was the experience of the tailor who actually knew the size of the body, whereas other people were working on stereotypes.
Yes.
Are there expectations, which I think is a very important principle of understanding what you're looking at. You have to realise the blind spots that you have yourself and the way that you might not see something because you're not expecting to see it.
Or put another way, you see something as you expect to see it.
Exactly, yes. Okay, so thank you very much, Barbara. It's been a delight chatting with you, and I look forward to the next conversation.